So, Karen, before we even get started, can I just introduce you and let you tell the audience what you do and what are your main areas of expertise?
Sure. I am the women's naturopath. So I work, well, predominantly with women. Some men sneak through as well.
Yeah.
But I specialize in, they're much easier actually. I specialize in the management of gut health and hormones. And that might seem like an odd two to specialize in, but I initially had a real passion for women's hormones and understanding exactly how they work and what causes our cycles, how our cycles ebb and flow throughout the month. And I've always been really fascinated by things like that, and sexual health and holistic sexual health. And so when I finished uni, I was convinced that I was going to go into just, treating hormonal conditions. I started working for an integrated GP who specialized in gut health. And that's where I started to fall in love with the gut. And I soon realized that you can't fix hormones if you don't fix the gut. So, the gut underlies everything, as we know. And now it's one of my favorite areas to practice in. I think every single condition that you and I would treat would have an aspect of gut. So that's always where I start. Mm-hmm. And then I was mentored by the amazing Miranda. So she mentored me for a year, and that's where I really dived into things like endometriosis and fertility and PCOS, and have just married the two. So I guess the point is that, you can't treat hormones if you don't treat the gut, and that's why I think this will be a really great chat to unpack.
Absolutely. Yeah, and it's so interesting because, Karen and I studied at Endeavour College together, and I feel like we have kind of taken very similar paths in the things that we've been interested in. And whenever you and I catch up, we just could talk forever, always on the same page. So let's dive into this topic then. So obviously you and I see this a lot in clinic where people with debilitating period pain have to depend on painkillers. And this is something that I certainly experienced my whole life. From 13, 14, when the pain was really starting to kick in, went to the GP, they gave me a prescription for Ponstan, then I went back, said it's not enough, and they put you on the pill. That was the only two solutions. And then throughout life, I just would eat naprogesics every time I had my period, like they were going out of fashion. But then on the topic of gut health, of course, my gut started to really suffer from that. And I would get a lot of pain just from taking the naprogesic itself, and I was kind of weighing up which pain do I want more. So do you relate to any of this or see this in clinic as well?
Yeah, absolutely. Luckily, I've never had dysmenorrhea, so I've never had to take that many painkillers for period pain. But absolutely, I see this in clinic all the time, and it's like there's not enough education around, what the long-term results of taking of these things like NSAID and even paracetamol are. It's quite normal to be like, oh, I just, I took Panadol and it was fine, but I'd really like to change that thinking. It's quite dangerous to take a lot of these things for longer than a couple of days, but we're not told that, and they work, so we just keep using them. And I've had quite a few clients come in with actually things like gastritis and ulcers actually in their gut, and it's from these non-steroidal anti-inflammatory drugs, but actually that are quite useful and important for a lot of people. So I guess it's not about doing away with pharmaceutical drugs at all, because they can be really helpful. It's about how can we, first of all, educate, which is what I think we're doing now, educate and reduce the amount. And in some cases, I think we can actually even eliminate the use of pharmaceutical drugs and use something a bit more natural. I do see that quite a bit. Luckily, the codeine-based drugs are now a bit harder to get. They're not off the shelf, so that's good.
That's true, yeah. And, my next question was going to be, what are some of the side effects you see? But you've just hit the nail on the head with two really important ones, which is gastritis and ulcers. Is there anything else that you see as problems with them or long-term effects as well?
Yeah, I think the Panadol. I think Panadol we need to do a bit of education on, because I was doing a bit of research for this, and I was actually even shocked by the stats on Panadol. Like, we think it's such a benign tablet, and it's okay in small to moderate amounts of use. But the research I've read from the Liver Trust in the UK says that even taking two more Panadol than you're meant to can result in liver failure and death. And I was like, holy shit, no idea. And how many of us are just like, oh, I'll just take another two, because we're in pain for 3-4 days. In fact, up to 28% of liver transplants in the UK are due to accidental overdose of Panadol. I was shocked. I was like, oh my God, we need to tell people about this.
Oh my gosh. Wow.
Yeah. And so the amount of Panadol that you can take, everybody, it's 500 milligrams, so it's 1 to 2 tablets every 4 to 6 hours for 24 hours, or do not exceed 8 tablets in 24 hours. So that's 500 milligram tablets times 8. And I don't know, I myself a couple of times have even gone over that. So I think that information really needs to go out there.
Yeah, absolutely. And I'm sure that, similar things can be said for other painkillers as well, such as your other NSAIDs. And, it's interesting, obviously, talking about the liver, and we know that the liver has such a crucial role in hormonal conditions. And so not only are you further burdening like phase 1 and 2 liver detoxification, which is important for estrogen clearance, which we talk about in endo and period pain and all those kind of things, but also you're depleting your glutathione, and that's also linked to endo. And even when we come to fertility, poor egg quality and embryonic development. So it just really does have such a constant just cascade of events. So I suppose people are going to be listening to this though and be like, well, I don't want to be in debilitating pain, because I sure know I didn't. And whenever I would try and take that risk, a couple of times I ended up in hospital because the pain was that debilitating. So, and of course, so many people don't have the knowledge that you and I do, or didn't do a 4-year expensive degree to find out.
Yeah.
So let's talk about what are some of the key strategies that people can do to start mitigating this pain. So let's maybe even break it down. We'll talk about like maybe investigations that people need to start doing, and then talk about, what they can do from there. So what's your take on that?
Yeah, I think just maybe even quickly before we even do that, just chat about like if you are choosing a painkiller, and that is the way that you're going to go. If you have any gut issues, especially stomach issues where you have reflux and burping already, like, you want to stay away from the non-steroidal anti-inflammatories, because that might mean that you already have a vulnerable gut. And if you can, I guess, go for the paracetamol, but really stick within the boundaries there. When it comes to investigations, shall we chat about more pain, or are we going to talk endo, adeno, that kind of thing?
Yeah, I mean, I think all of that combined. I guess, yeah, we could be here all day, but like, what are some of the like the key ones that you would see in clinic?
Well, I always look at the gut first. So I've never seen an endo or adeno patient, or usually women with serious period pain for whatever reason, who don't have any sort of gut issues as well. Do you find that as well?
Oh, 100%, yeah. And it's like very acknowledged in the research anyway. Like, we're seeing the link between endo and that translocation of gram-negative bacteria. And also, I think it's around 90% of women with endo have IBS or, FODMAP intolerances. Yeah, so there's a lot.
Yeah. So I'll always do some investigations on that. I might not always do a stool analysis or a SIBO test. I may, a lot of the time, and also depending on budget, just start to ask a lot of questions around the gut. You know, are they bloating? Do they get reflux? Their bowel motions? And try from there piece together what I think it may be. I will often test SIBO if I think it's SIBO, because it's very nice. It's very good to get an answer for a lot of patients as to why they have IBS. And so I'll often do that test. Relatively inexpensive, you know, compared to other tests. Sometimes I may just treat the gut, you know, using some gentle antimicrobials and some prebiotic, something like that, and see how it goes. I'll always send to the GP if they haven't had any recent tests, and I'll do whatever I can to get as much as I can on Medicare, because it's really expensive. So your usual like full blood exam, biochemistry, iron, because a lot of these women are already depleted in iron. 100% be testing their B12 and active B12, and maybe just even looking into serum hormones as well, just to notice serum hormones aren't always the best way to test hormones, but if I'm noticing quite abnormal patterns there, then that's already a red flag for me. You know, things like vitamin D are going to be really important, because we know that certainly adeno and endo do have that real immunological kind of immune system derangement thing going on, as well as the inflammation. And in my questioning on that as well, in my questioning, I'm always going to be asking about their exposure to things like Epstein-Barr virus or herpes virus. There's a lot of research coming out now how there's some links to some of these, I guess, more stealth pathogens. What else would I test? Yeah, I would 100% do a Dutch test if I've got anything back abnormal, or if I'm just totally confused as to what's going on.
Yes.
Because sometimes you get that PCOS picture and you get endo picture at the same time, and you're just like, what is going on? Do you do Dutch as well?
Oh, it's the most commonly used test that I use. I love the Dutch so much, and particularly to look at the estrogen clearance, like what pathways that estrogen is going down, and more often than not, people with really bad period pain and endo and adeno, they will at least be high in that 4-hydroxy pathway, but also that low glutathione as well, which we obviously touched on with painkillers making worse. So then let's talk about what are some of the amazing things that people can start doing. I mean, obviously there's dietary and lifestyle, and then there's also very key supplements and herbs. So let's start on diet and lifestyle.
Yeah, and I guess you would have tried absolutely everything in the kitchen. I've tried to default my patients and experimented extensively and had some really great results. And especially recently, I think by doing a lot of gut work, I think that reduces pain significantly. And this is my clinical experience. Do you find that as well?
Yeah, absolutely. I mean, everyone is different. What I did find with myself was that addressing my gut, because I had chronic gut issues for a really long time, and definitely discovered I had very high methane dominant SIBO.
Oh.
Yeah.
Were you constipated? Did you get constipated?
Yeah, I was always prone to constipation. So, you know, that took a good couple of years to really, really correct and get my bowels to be working. And obviously as well, that's, you know, highlights the importance of estrogen clearance through the bowels and preventing that estrogen reabsorption through the estrobolome and all those fun things. So what was I even saying? Gut health.
Gut health, yeah.
With the, so you go.
We could just be like,
I know. I'll keep going on.
I actually have found that by addressing the drivers, and I know we will be talking about pain relief, but I do just think it's so important to address drivers, and I find by reducing leaky gut and addressing dysbiosis, and dysbiosis is when you may have an overgrowth of, you know, commensal or normal bacteria that should be there, but they're just overgrown, and not enough good bacteria. So it's kind of like your garden has got a few weeds in, and it's a bit overgrown. We need to prune the hedges. We need to do a bit of weeding, but we don't need to go and smash anything out. So I like to kind of balance the gut and do a lot of gut healing with a lot of nutrients. Like I'm so in love with quercetin and glutamine and vitamin A and turmerics and things like that. So I use all of those to heal the gut lining, and actually that's really important for any sort of mucous membrane integrity as well. So yeah, a lot of gut work. I could bang on about the gut for ages, but when it comes to the actual pain relief, I'm also actually going to look into methylation as well and make sure that there's and that's just a genetic issue that some people have, which means they don't detoxify estrogen properly. Actually, I'm one of those people. Last year, my estrogen all of a sudden went through the roof for no reason, and it was quite good for me to actually really go and dive deep into as to why and what I can do about it. And I was getting crazy PMS and really sore boobs, and it was my high estrogen. So
wow.
Turns out I'm quite an undermethylator, but I worked a lot with like prebiotic fiber and calcium D-glucarate to help excrete the estrogens from the gut. So yeah, working with methylation, and as I said, that's just a genetic thing that happens in the liver. Genetics influence how we methylate. So if I see in some tests like the Dutch test or low B12, I'm immediately starting to think, okay, I'm going to support the person's methylation pathways, and I'm going to support their liver phase 1 and 2 detoxification of their estrogens. And of course, we know that these conditions aren't just about estrogen dominance, they're about inflammation and immune system gone haywire.
Absolutely.
So in the gut, I'm going to be looking for any sort of bacteria that are overgrown, and reduce those to reduce the lipopolysaccharide kind of translocation that you were talking about. Because this endometrial tissue that's in the peritoneal cavity, it gets set on fire basically by LPS, and you just end up with this incredible, hot, painful, inflamed, your whole lower abdomen is just on fire. And this is why using anti-inflammatory herbs is going to be really, really important. I've got some of my favorites. I'll be interested to see what yours are.
I'm definitely going to jump straight into herbs and nutrients that we can use to get rid of that pain or significantly reduce it. So what are your favorites?
Actually, my new favorite I picked up from you. So it's the capragesic.
Yes. Yeah.
You did a chat on that, and I was super curious. So I got a few bottles, and I got a few free samples to send to some patients. So I've been using that for a couple of months and loving it. It's having some really, really significant pain reduction in my patients, to the point where they're going I don't know where it went. I don't know where the pain went. This is weird.
Wow. What is that?
So yeah, thanks for that tip, by the way. And I'm really loving it. It's Acacia senegalensis is the herb, as you know, just for everybody else. It's quite a newly discovered herb, strongly anti-inflammatory. Also strongly anti-inflammatory in the gut, that has this dual action, right? You might know a bit more about it than I do.
Yeah, that's I was going to add for sure, is that what they're finding is that not only are people finding a reduction in period pain, but they're finding that their IBS is reducing as well. So it definitely does have that dual action. So being anti-inflammatory in both systems, but also helping to modulate that bacteria in some way as well, which is pretty awesome, from for something that works so well for pain and can also be benefiting your gut health, it's actually quite unheard of. So that's definitely a favorite. I'm glad that you've used it as well. I was using it before, and then
I got a couple of free samples from the lovely people at Capragesic. So I have another few patients on it, and just I'm really loving it. So I wouldn't I wouldn't shout about something that I don't love. So I'm excited to experiment some more with that, especially because there's such a strong gut hormone link there with everyone. What else? So I'm working on the same pathways as NSAIDs, so the COX-2 pathway in how these non-steroidal anti-inflammatories work. And that's why things like turmeric, fish oil, and ginger work really well. So the old naturopathic classics.
A bit of cinnamon as well.
Oh yeah. Also, speaking of cinnamon and choline to really get that, kind of stagnant blood moving. That's a Chinese formula that sometimes I use if there's just really painful, stuck, stagnant blood, lots of clotting, lots of dark blood. I'll be using maybe for a couple of months to just really kind of move that out. And I remember Miranda taught me that, and she was always like, it's like a herbal DNC, which sounds a bit dramatic, but it's like, like how it works to like just clear everything cleared out.
And it's very, sorry to jump in, it's very indicated for adenomyosis. That cinnamon and choline formula are very indicated for that. And obviously all the symptoms you just mentioned that are very much adenomyosis. Sorry, my dog was just running.
So funny.
She's found someone outside. So what about, there are so many beautiful herbs that we could go on, even like obviously California poppy, corydalis, crampbark, Jamaica dogwood, black pepper. Like there are so many beautiful herbs. And they
you use black pepper,
because I was reading into herbs for endometriosis in particular. And so black haw and crampbark are from the same family. But it seems that black haw has more of an affinity for the uterus. So so I started using that over crampbark, although I still use crampbark as well. But sometimes,
isn't it?
Yeah, I feel like as a naturopath, you just like start to build this instinct around what herb is best for someone. And I think it's just because you start to identify these nuances in everyone's presentation. You just get this feeling, you're like, I think this is going to be better. And same with even Capragesic, like sometimes I think all you need is Capragesic, and they find that it works amazing. So, but everyone is so different. Like one formula can work for someone and not do anything for someone else. So
and that's herbal medicine, isn't it? It's very specific. It goes with the energetics of a specific person's body. That's why it's so good to have like a proper herbalist who's prescribing these as well.
100%. I mean, we're always bang on about like do not self-prescribe, like always seek help from someone. And even like obviously Capragesic is publicly available and it's really safe, so people can access that. But take it to the next level and like get that whole holistic perspective. Obviously, you and I have already touched on like the testing. We haven't even touched on diet yet, like reducing inflammation, even reducing your exposure to certain endocrine disrupting chemicals, and all the nutrient deficiencies that we always see. Like there's not one person that comes to us that has a perfect nutrient profile. It's always the way. So
what's your number one? I know what you're going to say. What's your number one nutrient for pain, for period pain?
Nutrient. Oh God, that is so hard because again, everyone is so individual. I have dabbled with a bit of PEA, palmitolethanolomide. And that's very hit and miss. Like some people it works brilliantly for, some people not so much. NAC obviously for endo is just so indicated to get that glutathione production up.
Or if you've been taking paracetamol, everyone.
Exactly. So I think getting everyone onto that NAC to overall, get that inflammation down and, work on so many other. Oh, actually, how can I forget like magnesium?
I know you were saying that.
Those obvious ones that you can absolutely magnesium. I mean, even if it's like I mean, for some people, just magnesium alone helps with pain, along with some like zinc. I mean, we know that there's studies that show that zinc deficiency has been linked with period pain. It depends on are we talking about primary dysmenorrhea, which is like, you know, non-condition related, or is it secondary where it is adeno, endo, etc. But, you know, just zinc and magnesium can be so incredible. And the thing is, though, so many people come to me and say, oh, yeah, I'm taking magnesium, I'm taking this like Swiss or something. And I'm like, that's just not enough. It's not the right type. It's never going to hit the sides for you. You know, you're like high dose, getting like that magnesium bisglycinate or magnesium citrate.
Absolutely.
What about you? What's your favourite?
100%. If they're not on a magnesium, they're going to get one, because, you know, that's going to be, you know, we were always taught, you know, use the least intervention necessary. And for us, like magnesium, if you don't have enough magnesium, that's going to affect so many, you know, your sleep, your mental health, and usually a lot of us are stressed right now, and especially people who experience a lot of pain. And I have really great results with, you know, 300 to 600 milligrams even of that of magnesium, and things like glycine and taurine as well. Our amino acids are just gorgeous as well. I'd agree as well. Definitely magnesium and zinc are my first two. I've had really good results with PEA, but at higher doses, so 1200 milligrams.
And long term as well. Like, unfortunately, at the moment, the disclaimers are like, don't exceed 21 days of use. However, the research shows that to be effective for endo is to take it 3 months consecutively. So
there is a bit of a caveat on that, and it's because the TGA require all pain relief to carry that 21-day warning. However, there is research that says it's safer for longer, but, you know, we need to stick within the guidelines. So sometimes I just will prescribe PEA for the week before and of the period, so then you're kind of like skipping that.
Absolutely. So obviously, you know, when it comes to debilitating period pain, sometimes even diet alone doesn't really do anything, but it can actually significantly improve a lot of people's lives, just diet alone. And obviously, because you're also addressing the gut by correcting diet. I mean, even, you know, I've had clients just remove dairy and wheat, and it's just made the most profound difference on their life. And I know people get so up in arms about taking that precious dairy and wheat away from them.
That's the sourdough.
What about sourdough? What about spelt? Are there any particular like really key dietary strategies you see that do help to reduce that inflammation?
Inflammation wise, as you said, pain wise, I'm not 100% sure, maybe in the longer term. But dairy and gluten, as much as I do love a slice of bread, does anyone? We all do. People just do better without it, especially those who are experiencing dysmenorrhea or period pain, or even just irregular cycles. It is an inflammatory food, and clinically, time and time again, people feel better without it. You know, I know the research is sometimes a bit vague, but clinically what I see, so that's what I do. And what other foods, I mean, brassicas, if we're talking about those estrogen pathways, your brassica vegetables like broccoli, sprouts are going to be amazing. Any sort of brassica foods like your cauliflower or your broccoli, anything like that's going to help that estrogen move through the liver properly. Fiber is one of my number ones, prebiotic fibers. And a lot of people are FODMAP as well, so I have a lot of FODMAPers. And that just like, it's an IBS diet basically, so that means they can't have a lot of fiber. They're often quite deficient, and we know that just means that the estrogen is being recirculated back into circulation. So your liver could be working perfectly and it's done all the good work to get rid of the estrogen, and it gets to the gut and it's just about to leave, and then we have this, you know, bacteria is producing this enzyme that just basically undoes all the good work that the liver's done and sends the estrogen back into circulation. So a really good way to get that working properly is lots of lovely fibre and maybe even probiotics to kind of balance out that bacteria. The prebiotic fibres that I find I use the most, which are safe with FODMAPers, well, 99% of FODMAPers, caveat, is the partially hydrolyzed gum gum, acacia gum, and special mention, my love, slippery elm.
Yeah, yeah.
Love it very much.
Yeah.
Yeah, it's a lovely demulcent, soothing prebiotic, and it doesn't really set anybody off. So daily.
Yeah, and I was actually going to mention slippery elm back when we were talking about painkillers, because I say to my clients as well, like, if you are going to be taking NSAIDs or other things that may be abrasive to the gut, at least take some slippery elm around it so that it can help to line that stomach and the gut to prevent that.
Yeah, good one. Yeah, nice all after a meal.
Yeah, and it's so
really
cheap.
nice.
You know, it's actually a really cheap thing you can do and so good for you. And, you know, with the right amount of hydration can help with laxation as well.
Yeah, it's everything. I think everybody gets it.
Yeah, and the others, of course, as well.
Yeah.
Cool. So is there anything else that you wanted to add when it comes to this topic, or do you think we've covered it?
Well, what about other, like, pain relief wise, you know, what about things like, you know, like the physical things that we can do for pain? Like, I know you work with the type of TENS machine, right?
Yeah.
Right?
Yeah, TENS machines are fabulous. I recommend them to all my endo clients and anyone with pain. Majority of the people love it and find it works really well. Every now and then you'll get someone who just can't stand the feel of the TENS itself, because it does. Have you ever felt it? Felt one?
Yeah.
They're so weird. Like, they have that really weird sensation, but after a while you like really favor that feeling over feeling the pain. So I personally use Overa, and I had used just a basic TENS before that, and it just wasn't really like cutting it. And then when I tried the Overa, I was like, oh, this is like, you know, particularly designed for period pain. Like, it's just really high strength. So that's definitely a really good one. Good mention. Yeah,
great. Yeah, and I mean, there's things like acupuncture and castor oil packs. I know Leah Heckman is a huge fan of putting just coriander seed oil that she puts in her castor oil packs.
I've never had that.
I think it breaks up the lymphatic, like the inflammation. Otherwise, like clary sage, rose oil.
Yeah, beautiful.
Like a pelvic physio, you know, for those really functionally stuck kind of strictures and stuff could be really good.
Yeah, actually, pelvic physio is a really good recommendation as well. I do hear some people get really good benefits from that, particularly if there's just a lot of spasming going on in there. They can really help to release that. So that's a really good tip as well.
Yes.
Beautiful.
Yeah.
If anyone's got any questions, feel free to start posting them in the chat, because we will wrap up in a minute. But Karen, if anyone is loving what you're putting down today, where could they find you or book in with you?
You can go to my website. It's Karen dash, that's Karen, that little hyphen in the middle, saunders.com, or on Instagram, Karen Saunders Naturopathy. And yeah, you can also book in for a 10-minute, like a free 10-minute phone chat if you're not sure what it's about, what you're about, or what I'm about. But yeah, pretty much anything gut and hormones is so my jam.
Yeah,
love it.
Awesome. Oh, Capra G's chimed in here. Hi, it's Claire. When we use any of these everyday painkillers like paracetamol or ibuprofen, should we be taking a prebiotic or probiotic at the same time to help the gut? Karen, what's your thoughts?
I think you covered that one with the slippery elm. That's a good one. Yeah, I think especially with the NSAIDs. As I said, definitely do a prebiotic. They won't necessarily affect your gut bacteria too much, so I wouldn't say you would need a probiotic if you're taking a painkiller. Yeah, just watch the length of time that you take these things. Really read the label. Yeah.
And I think, you know, if you've been taking painkillers long term, you're probably going to need some pro and prebiotics anyway to like repair all the damage. But certainly if there's one thing we would pick, it would be slippery elm for sure. So Sarah J. Arthur has said, do you take Capragesic when you feel pain, or do you take it on a certain date of your cycle? Fantastic question, because it definitely has been shown to be more effective when you take it a few days up to even a week leading up to the pain, to really start getting on top of that. And, you know, that's what we, you know, whenever we're using, whether it be herbal medicine or fish oil or anything that we're working on the inflammatory pathway, we're trying to get that inflammation down before it hits. Because unfortunately, once the hurricane has arrived, there's not too much you can do to mitigate that. So that's a fantastic question. Definitely start earlier. On the Capragesic website, they actually have advice on how the best way to use it. Beautiful. All right. If there's no other questions, I want to thank you, Karen, for joining us. That was an absolutely fantastic interview. I'm so glad that we've done.
Yeah, me too.
So much amazing information, and you know, you and I could talk about this all day. Like, there are even deeper rabbit holes we could have gone down, but we just have to.
Yeah, I'm pretty proud that we didn't. We kept it on.
Awesome. All right. Well, thanks everyone for joining. This will be reposted after, of course, and Capragesic will also be adding it to their website as part of a bit of a content library that they're making, so that anyone can go to find out information on all things women's health. So stay tuned for that. Thanks, everyone. Bye.
See ya.
Bye.